Did you know that some of your daily habits could be damaging your kidneys and making their recovery difficult? Yes, it is true. The kidneys are vital organs that work tirelessly to filter waste, balance fluids, and support our overall health. However, many of us unknowingly do things that damage them and reduce their efficiency. So, in today's video, we will explore the 10 daily habits that could be damaging your kidneys and affecting their healing and performance. By understanding and avoiding these common things, you can take proactive steps toward better kidney health and overall health. So, let's begin. Number 1. Not drinking enough water. Proper hydration is necessary for healthy kidney function. As mentioned earlier, kidneys play an essential role in filtering waste from your blood and producing urine. To perform these functions effectively, they require a constant supply of water. When you do not drink enough, your kidneys struggle to filter waste, which causes an accumulation of toxins in your body. Moreover, dehydration causes your urine to become concentrated. This concentration can irritate the delicate tissues in your kidneys and increase your risk of developing kidney stones. These stones are hard, painful deposits that form when waste products crystallize in your urine. The formation of kidney stones can be extremely painful and can further damage your kidneys over time. Chronic dehydration can also cause a gradual decline in kidney function. When your kidneys are consistently deprived of adequate fluid, their ability to filter waste effectively diminishes, which can lead to more severe health issues. So, to prevent these problems, it is crucial to stay well hydrated. Aim to drink at least 8 glasses of water a day, though your individual needs may vary based on factors like physical activity, climate, and overall health. Keep a water bottle with you throughout the day. This can help ensure that you are drinking enough. By maintaining proper hydration, you support your kidneys' vital functions and protect them from unnecessary strain and damage. Number 2. Consuming excessive sugar. Sugar is a common ingredient found in a wide variety of meals and drinks, and it is sometimes hidden in items that even do not have a particularly sweet taste. Generally, taking sugar is not hazardous. However, consuming excessive amounts of sugar regularly can have major consequences for the health of the kidneys. This is because consuming a lot of sugar can cause weight gain and obesity, both of which put additional strain on the kidneys since they have to work harder to filter waste and keep the fluid balance in the body. In addition, a diet that is rich in sugar is associated with an increased chance of developing type 2 diabetes, a condition of having high blood sugar levels. This condition can cause damage to the small blood arteries in the kidneys, which subsequently results in diabetic nephropathy. If treatment is not received, this disease has the potential to develop into kidney failure. In addition, consuming an excessive amount of sugar can be a contributor to high blood pressure, which in turn causes kidney damage to become even more serious. So, if you want to protect and heal your kidneys, check and minimize the amount of sugar you consume. For this, read labels, reduce the number of sugary drinks and snacks you consume, and choose sources of sweetness that come from nature, such as fruits. Number 3. Holding in your urine. Holding in your urine is a common habit that can have serious consequences for your kidneys. Whether you are busy at work, stuck in traffic, or too absorbed in a task, delaying bathroom breaks might seem like a minor inconvenience, but it can actually strain your bladder over time. When you consistently hold in your urine, you put excessive pressure on your bladder. This can cause it to stretch or weaken, which means it might not empty fully when you finally do go. Incomplete bladder emptying increases the risk of urinary tract infections called UTIs. If these infections are not treated promptly, they can spread to your kidneys, where they cause severe kidney infections. Furthermore, regularly holding your urine can contribute to the formation of kidney stones. When urine stays in the bladder for too long, minerals in the urine have more time to crystallize and form stones. Kidney stones are not only painful, but can also cause additional strain on your kidneys, which potentially leads to more serious issues over time. So, to keep your kidneys healthy, listen to your body and use the restroom as soon as you feel the urge. Avoiding this habit helps prevent unnecessary pressure on your bladder and reduces the risk of infections and kidney stones. Number 4. Consuming too much salt. Sodium, a main component of salt, is essential for maintaining fluid balance, nerve function, and muscle contractions. However, its excessive intake forces your kidneys to work much harder. This is because when you eat too much salt, your kidneys have to work harder to filter out the extra sodium from your bloodstream. Over time, this increased workload can degrade kidney function and overall health. Additionally, high salt intake causes your body to retain water, which raises blood volume and subsequently increases blood pressure. Chronic high blood pressure is a major risk factor for kidney damage and can worsen conditions like chronic kidney disease, because it damages the blood vessels supplying kidneys and reduces their functioning efficiency. Moreover, excessive sodium can also cause the formation of kidney stones, which are not only extremely painful, but can also cause long-term harm to your kidneys. To protect your kidneys, it is important to limit your salt intake. For this, reduce your consumption of processed and fast foods, which often contain hidden sodium. Instead, use fresh herbs, vegetables, and fruits to enhance the flavor of your meals naturally. By managing your salt intake, you help reduce the stress on your kidneys and support their long-term health. Number 5. Not managing diabetes. Diabetes is a leading cause of kidney disease because high blood sugar levels damage the small blood vessels in your kidneys. This damage degrades their ability to filter waste and maintain fluid balance, which eventually leads to a condition called diabetic nephropathy. If left unmanaged, diabetic nephropathy can progress to chronic kidney disease or even kidney failure. To prevent this, it is essential to manage your diabetes carefully. So regularly monitor your blood sugar levels, eat a balanced diet, do regular physical activity, and adhere to prescribed medications. This forms the core of an effective diabetes management plan. Additionally, control other risk factors like high blood pressure and high cholesterol, as these can further exacerbate kidney damage. By taking proactive steps to manage your diabetes, you greatly reduce the risk of kidney problems and support overall kidney health. Work closely with your healthcare provider to develop a tailored management plan that fits your needs. This comprehensive approach helps protect your kidneys from damage, maintains their function, and improves your overall well-being. Number 6. Eating processed foods. Eating processed foods regularly can be harmful to your kidneys. While these foods are convenient and often taste good, they come with significant risks. Firstly, they are usually high in unhealthy ingredients, such as sodium, sugar, unhealthy fats, and artificial additives, all of which can be problematic for your kidneys. For example, the excessive sodium found in many processed foods can raise your blood pressure, which is a major risk factor for kidney disease. High blood pressure puts extra stress on your kidneys and makes it harder for them to filter waste and maintain fluid balance. Secondly, processed foods often lack essential nutrients and are filled with additives that can create an acidic environment in your body. This added acidity can strain your kidneys, which must work harder to maintain a proper acid-base balance. Over time, this can cause kidney damage and other health issues. Moreover, regular consumption of processed foods can also contribute to weight gain and obesity, which increase the risk of developing conditions like diabetes and high blood pressure. Both of these conditions are known to negatively impact kidney health. To protect your kidneys, try to reduce your intake of processed foods and focus on eating natural, whole foods. Add plenty of fresh fruits, vegetables, whole grains, lean proteins, and healthy fats to your diet, and prepare meals at home from fresh ingredients to ensure you get the nutrients your kidneys need to function properly while avoiding the harmful effects of processed foods. Number 7. Overusing painkillers. To control pain and swelling, many people take painkillers, especially NSAIDs, or non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and naproxen. Even while these drugs have the potential to give significant treatment, overuse of them can have serious consequences for the health of the kidneys. NSAIDs are effective because they reduce inflammation. However, they also reduce the blood flow to the kidneys, which affects the kidney's capacity to function normally. Analgesic nephropathy is a condition that might develop as a result of making use of these drugs regularly. This disorder is characterized by damage to the kidneys that cannot be reversed and a steady deterioration in the function of the kidneys. With time, the kidneys may have difficulty filtering waste and maintaining fluid balance, which may eventually result in chronic kidney disease development. Therefore, it is important to use painkillers only when necessary and to avoid using them frequently or for an extended period. When you discover that you require pain relief frequently, it is important to seek the advice of a healthcare expert to find alternative treatments or the underlying causes of your pain. This will ensure that you protect your kidneys from any potential damage. Number 8. Ignoring high blood pressure. Ignoring high blood pressure can have serious consequences for your kidney health. Often called the silent killer, high blood pressure puts extra stress on blood vessels throughout your body, including those in your kidneys. These blood vessels are crucial for filtering waste and excess fluids from your blood. When blood pressure remains high over time, it can damage these vessels, which degrades their ability to function properly. This condition is known as hypertensive nephropathy. Moreover, damage from high blood pressure can speed up the progression of chronic kidney disease, which eventually leads to kidney failure. So to protect your kidneys, managing high blood pressure is crucial. For this, make lifestyle changes such as adopting a balanced diet, low in salt, engaging in regular physical activity, reducing stress, limiting alcohol consumption, regularly monitoring your blood pressure following your healthcare provider's advice, and taking prescribed medications if needed. Number 9. Drinking too much alcohol. Drinking too much alcohol can have serious consequences for your kidneys. This is because the kidneys are responsible for filtering alcohol out of your bloodstream. When you drink excessively, your kidneys must work harder to process and eliminate this substance. This increased workload strains your kidneys. Alcohol consumption also causes dehydration, as alcohol acts as a diuretic, which means it increases urine formation and causes you to lose more fluids. Dehydration puts significant stress on your kidneys by reducing blood flow and disrupting the balance of fluids and electrolytes in your body, which impairs your ability to function effectively. Chronic alcohol consumption can also cause liver damage. The liver and kidneys work together to detoxify the body, so damage to the liver can negatively impact kidney function. Heavy drinking is also linked to high blood pressure, which is a major risk factor for kidney disease and kidney failure. To protect your kidneys, totally stop alcohol consumption or drink alcohol in moderation. The general recommendation is to limit your alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. If you find it challenging to adhere to these limits, seeking professional help to reduce or eliminate alcohol consumption may be beneficial. For those who already have kidney problems or are at high risk for kidney disease, it may be best to abstain from alcohol completely. By managing your alcohol consumption, you can significantly reduce the risk of kidney damage and support overall kidney health. Number 10. Smoking. Smoking is widely recognized for its detrimental effects on the lungs and heart, but its impact on kidney health is equally concerning. When you smoke, hazardous chemicals enter your bloodstream and make their way to your kidneys. Once there, they cause inflammation and damage to the delicate blood vessels that are responsible for filtering blood. This damage can degrade the kidney's ability to perform their essential functions, which can lead to a buildup of toxins in the body. Smoking also reduces blood flow to the kidneys, further compromising their function and increasing the risk of chronic kidney disease. Moreover, those who smoke have a greater likelihood of acquiring kidney cancer, particularly if they smoke heavily or for an extended period. Smoking can also worsen other risk factors for kidney disease, such as high blood pressure and diabetes. The good news is that quitting smoking can have a profound positive effect on kidney health. The effects of quitting smoking can be seen within a few weeks, including improvements in blood circulation and a reduction in kidney strain. There are numerous resources available to assist with quitting, including support groups and nicotine replacement therapies, making it important to seek help if you need it. And there you have it. 10 daily habits that could be damaging your kidneys and affecting their healing and performance. Remember, it's never too late to start making healthier choices. Each positive change you make brings you one step closer to better kidney health and a longer, healthier life. Take the time to evaluate your habits, make necessary adjustments, and give your kidneys the care they deserve. Thanks for watching, and if you found this content helpful, please like our video and subscribe to our channel for more informative content.